What if the reason a multi-thousand-dollar IVF cycle fails has literally nothing to do with the Western hormones you were prescribed, but the fact that the acupuncturists you hired to support that cycle only learned their trade over a 2-weekend crash course?
Yeah, I mean, that is a terrifying thought, but it's a reality we really have to look at today.
Right. Because if you or someone you know has navigated the world of infertility, the stakes are just incredibly high. It is this profoundly personal, life-altering pursuit.
Oh, absolutely.
And when you step into the realm of integrative fertility care, so specifically using like acupuncture and herbal medicine alongside your Western treatments, you just kind of assume the practitioners guiding you are experts.
You do. You assume they have years of specialized training.
Exactly.
Yeah.
But there's this massive and honestly often invisible gap in this field between superficial, entry-level training and actual decades of highly specialized clinical mastery.
And that gap, it's really reshaping how we need to think about complementary medicine. Because we're looking at a medical landscape right now where it has become increasingly common for just general acupuncturists to take a really short seminar.
Like how short are we talking?
Well, perhaps a 2-weekend course focused entirely on infertility.
Just 2 weekends. Wow.
Yeah, and in that time, they receive a broad overview of reproductive physiology, a handful of standard herbal formulas, and, a set of basic acupuncture points.
Okay, so a crash course.
Right.
Right.
And, I mean, that might be a decent start in line for someone looking to treat mild, uncomplicated issues. But, as we know, infertility is rarely a simple, isolated mechanism.
Okay, let's unpack this. Because taking a weekend course to learn standard acupuncture points and then attempting to manage complex reproductive endocrinology, it's like taking a weekend CPR course and then being asked to run an emergency room.
That is a great way to put it.
Right. Like the absolute basics, but you don't have the reps for the complex cases. You might think you're helping, but without understanding the underlying architecture, you could easily do more harm than good.
Exactly. Because the patients seeking out this care are not blank slates.
No, not at all. They are dealing with advanced maternal age, diminished ovarian reserve, recurrent implantation failure.
Yeah, and they bring a multi-year history of severe male factor infertility, endometriosis, PCOS, or recurrent pregnancy loss.
So weekend protocol just isn't going to cut it for that.
No, it really isn't. What's fascinating here is the underlying pathophysiology of those conditions you just mentioned. A textbook protocol taught over a weekend assumes a standardized cellular environment.
Right, like everyone's body is exactly the same.
Exactly. But let's look at endometriosis, for example. It doesn't just cause physical blockages, which is what a lot of people think. It actually creates a highly toxic inflammatory pelvic environment.
Oh, wow. So it's actively hostile.
Yeah. The immune system is actively flooding the reproductive organs with cytokines.
Cytokines, those are inflammatory proteins, right?
Yes, exactly. And those proteins can actually degrade egg quality and make the uterine lining completely hostile to an embryo.
That's terrifying. So a generic one-size-fits-all acupuncture protocol just wouldn't even touch that.
Right. It simply does not possess the targeted specificity required to downregulate that localized immune response, while simultaneously supporting the ovaries during a highly stimulated IVF cycle.
Because trying to apply a generic checklist to a multi-year history of failed IVF cycles is fundamentally mismatched to the biological reality of that patient.
It really is.
And these are people looking for a lifeline. A superficial approach can actually cost them crucial time that they really don't have.
Time is everything in fertility.
It is. So if generic protocols fail the complex cases, we have to look at what actual verified mastery looks like in practice. Which brings us to the core of our deep dive today. Mike Berkley and the Berkley Center for Reproductive Wellness in New York City.
Yeah, their timeline alone is a massive indicator of deep specialization.
Right, because it was founded in 1998, well before integrative medicine became, a trendy buzzword.
Decades before, making it the first clinic in the United States established exclusively to treat fertility using integrative methods.
That's a huge distinction, exclusively treating fertility.
It changes everything. Doing nothing but treating reproductive disorders for over 28 years completely alters a practitioner's clinical database.
Because you're not just relying on theory anymore.
Exactly. You have thousands of patient encounters mapping exactly how specific interventions alter reproductive outcomes. And, the foundation for that practice wasn't a weekend retreat.
Far from it. Berkley graduated from the Pacific College of Oriental Medicine. And that requires 4 rigorous years of acupuncture training, right?
Yes, followed immediately by 2 additional years of advanced herbal medicine study.
Wow.
Add to that national board certifications in both acupuncture and Chinese herbology, and status as a fellow of the American Board of Oriental Reproductive Medicine, or FABORM as it's known.
Okay, now let me push back on this premise just a little bit,
Sure, go ahead.
because we're talking about two vastly different paradigms here. You've got Eastern medicine with its focus on meridians, energy flow, herbal synergy, and then you've got Western reproductive medicine.
Right, the synthetic gonadotropins, trigger shots, microscopic embryo grading.
Exactly. And historically, these are completely separate worlds. They use entirely different diagnostic frameworks. So how do these two completely different medical languages actually talk to each other in a practical clinical setting without, something just getting lost in translation?
That's the million-dollar question. And the answer is they only talk to each other if the practitioner is truly bilingual.
Bilingual in medicine, I like that.
That is the core concept of dual mastery here. Berkley didn't just stop learning when he mastered the Eastern modalities. For over 2 decades, he has aggressively immersed himself in Western reproductive endocrinology.
So he's actually reading the Western science.
Oh, constantly. He studies the peer-reviewed Western medical literature and maintains ongoing dialogues with leading reproductive endocrinologists.
Wow.
Because of this, he can look at a patient's Western diagnostic results and extract data that a traditional acupuncturist wouldn't even know how to fully utilize.
Right, so he isn't just looking at the patient's pulse or tongue, which is standard in Eastern medicine.
Exactly. He is analyzing day 3 FSH levels, AMH, and antral follicle counts. He's examining detailed semen analyses and the pathology reports from endometrial biopsies.
Because if you don't know what, say, an AMH level of point actually signals about the follicular environment, how can you possibly formulate an herbal compound to support that specific patient's ovaries?
You can't. You'd just be guessing.
Right. And AMH, or anti-Mullerian hormone for those who might not know, it reflects the size of the remaining egg supply. So a low number means the ovaries are going to be highly resistant to the stimulation drugs used in IVF.
Very resistant.
You can't just throw a generic fertility herb at that and hope to the best. You need to know exactly how to alter the hemodynamics, the blood flow to the ovaries, to help those Western drugs actually reach the follicles more efficiently.
Precisely. And taking that technical Western data to completely customize the Eastern treatments requires a really deep understanding of pharmacology.
Right, because herbs are medicine. They have chemical reactions.
Exactly. If an acupuncturist prescribes an herb with, say, phytoestrogenic properties during a specific phase of an IVF cycle, it could inadvertently compete with the Western estrogen medications.
Oh, wow. So they could literally be fighting each other.
Yeah, potentially derailing the entire cycle. A master who understands both systems ensures that integrative treatments are adjusting in real time.
That makes so much sense.
Whether the patient is undergoing controlled ovarian hyperstimulation to recruit follicles, or they are in the luteal support phase after an embryo transfer, the integrative care is specifically tailored to enhance, not hinder, that exact phase of the Western cycle.
Okay, so understanding the philosophy and the educational background is one thing, but translating that into the actual physical treatment of the human body is where the rubber meets the road.
Absolutely.
Because the ultimate goal here isn't just making the patient feel relaxed. I mean, stress reduction is a nice side effect, obviously.
Sure, it helps.
But the targeted treatments are aimed at improving specific foundational biological determinants of reproductive success. We are talking about physically altering egg and embryo quality. We're talking about improving the endometrial lining.
Right, both the physical thickness measured on an ultrasound and the chemical receptivity required for an embryo to actually implant.
Yeah. And we have to look at sperm parameters as well, right?
Oh, definitely. Male factor is a huge part of this.
Yeah.
And it's heavily influenced by the biological environment. It is not just about sperm count and motility. It is about morphology, the physical shape of the sperm, and crucially, DNA integrity.
Right. The DNA fragmentation.
Yes. High levels of oxidative stress in the body can literally break the DNA strands inside the sperm head.
That is wild.
It is, and this DNA fragmentation is a massive hidden cause of recurrent miscarriage and failed IVF. Highly specialized integrative care uses precise anti-inflammatory and antioxidant measures to fix that.
like through specific herbal medicine and targeted therapy.
Exactly. To repair that cellular environment and protect the DNA from oxidative damage before conception even occurs.
And the actual tools used to achieve these biological shifts, they go way beyond just traditional acupuncture needles.
Yeah.
There is a deep integration of modern technology here, specifically low-level light therapy.
Yes, utilized at exactly 830 nanometers.
Okay, so what is so special about 830 nanometers?
The mechanism behind that specific wavelength is just incredible. At exactly 830 nanometers, low-level light penetrates the tissue and directly stimulates the mitochondria.
The powerhouses of the cell.
Exactly, the battery packs. As women age, their egg cells naturally lose cellular energy. And the process of an egg dividing and forming a healthy embryo requires a massive amount of ATP, or cellular energy.
So if it doesn't have enough juice, it just stalls out.
Right. If the energy falls short, the chromosomes don't divide properly. That leads to genetic abnormalities and failed implantation. But by applying this specific wavelength of light, it triggers an enzyme in the mitochondria called cytochrome plus oxidase.
Okay.
And that enzyme produces more ATP. So it is quite literally giving an older egg the surge of cellular energy it needs to divide normally during an IVF cycle.
Wow. It's physically supercharging the cellular environment.
It really is.
And the timing of when these interventions happen is just as critical as the interventions themselves. The entire care model at Berkeley is built around the patient's Western medical schedule.
Which is so rare to find.
It is. Pre- and post-embryo transfer acupuncture is available on the exact same day of the transfer. And they even offer flexible hours because, as anyone who has done IVF knows, clinics will change your transfer time at the drop of a hat.
Oh, constantly.
Having the practitioner available on that specific day is crucial because the immediate goal right after a transfer is to stop the uterus from spasming and rejecting the embryo.
Right, and that same day, timing leverages the immediate physiological effects of acupuncture. By stimulating specific nerve pathways, it calms the central nervous system, which downregulates uterine contractility.
So it literally tells the uterus to relax.
Exactly, and simultaneously, it dilates the uterine arteries, flooding the endometrial lining with oxygen-rich blood to create the ideal environment for implantation.
Okay, here's where it gets really interesting. The care protocol does not stop the moment there's a positive pregnancy test.
No, it bridges into the next phase.
Right. They provide dedicated miscarriage prevention care that continues all the way through the 13th week of pregnancy. Because anyone who has navigated infertility knows the terrifying reality that getting pregnant is only the first hurdle.
It's just the beginning.
The anxiety during that first trimester is suffocating. That is the window when the vast majority of pregnancy losses occur. So extending the treatment bridge through that vulnerable 13-week period really demonstrates a profound understanding of the full reproductive journey.
It does. And if we connect this to the bigger picture, the 13-week mark is biologically significant.
How so?
Well, during the first trimester, the pregnancy is sustained by progesterone produced by the corpus luteum on the ovary. But around week 10 to 12, there is a massive physiological shift.
The placenta takes over, right?
Exactly. The newly formed placenta takes over the hormone production to sustain the pregnancy. And it is a highly precarious transition. Furthermore, the maternal immune system has to actively suppress itself so it doesn't recognize the embryo as an invader.
Because it's 50% foreign DNA from the father.
Right. So ongoing integrative care during this window focuses on modulating that immune response and ensuring optimal blood flow to the developing placenta until it is fully established.
Okay, so theory and biological mechanisms are fascinating, but honestly, they only matter if they produce real-world outcomes.
Results are what count.
Exactly. And when we look at patient experiences and the reception from the broader medical community, the impact of this dual mastery becomes undeniable. Like, take the case of Kate Morrell.
Yeah, that's a powerful one.
She struggled for 3 years to conceive and ran into a very frustrating reality of modern medicine. She found that most healthcare providers just wanted to, quote, move her along. They were managing her symptoms, but didn't have the bandwidth to investigate the deeper systemic issues.
And that happens so often. In a high-volume clinical setting, complex cases often get pushed into standardized protocols simply due to time constraints.
It's a systemic problem.
It is. But Berkley's approach completely inverted that model for her. He invested the time up front, creating a comprehensive plan that addressed her specific physiological roadblocks. And within 2 months of initiating that deeply customized approach, she achieved a healthy pregnancy.
2 months after 3 years of struggling. That is incredible. But the case that really stops you in your tracks is the verified patient who came to the Berkeley Center after experiencing 6 failed IVF cycles.
6. That is an enormous burden.
We really have to pause and actually consider the weight of that. 6 failed cycles. The emotional devastation of a single failed cycle is immense.
It's heartbreak every single time.
You endure weeks of hormone injections, the invasive retrieval, the agonizing wait for the embryo report, and the transfer, only to experience the crushing grief of a negative beta test. To survive that biological and emotional crash 6 separate times and still possess the resolve to seek out an integrative specialist for a 7th attempt. It requires an unbelievable amount of resilience.
It really does, and from a clinical perspective, a patient with 6 failed cycles possesses an incredibly complex diagnostic puzzle.
Because nothing has worked.
Right. Their body has repeatedly failed to respond to the most advanced interventions Western medicine has to offer. So for that 7th attempt to result in a successful pregnancy after integrating Berkeley's care is just profound.
It changes everything we think we know.
It demonstrates that when you properly alter the foundational cellular environment, when you address the hidden oxidative stress, optimize the mitochondrial function, and perfectly synchronize the Eastern support with the Western stimulation, you can change the outcome of even the most refractory cases.
And the clinical validation doesn't just come from the patients. It comes from the other side of the medical aisle, too.
Which is usually very critical.
Extremely. Board-certified reproductive endocrinologists, MDs, who are inherently and rightfully skeptical of unregulated alternative therapies, actively recognize and rely on this expertise, like Dr. David Hoffman from IVF Florida.
Right. He's known Berkeley professionally for years.
Yes, and he noted that Berkeley, quote, probably reads more than most active REIs in practice. For a specialized Western physician to acknowledge that an integrative practitioner possesses that level of endocrinology knowledge is incredibly rare.
It really speaks to the safety and efficacy of the dual mastery model.
It does.
Dr. Joe Massey added another crucial point, too, highlighting that Berkeley works from a medical history taken in the mode of Western medicine.
So he's speaking their language from minute 1.
Exactly. He approaches the patient with the same analytical framework as an REI. When an MD knows that the acupuncturist fully comprehends the half-life of the fertility drugs being administered and knows exactly how to formulate herbs that won't disrupt liver enzymes or antagonize the stimulation protocol, it completely shifts the dynamic.
They stop seeing them as a risk.
Right. They transition from viewing the integrative practitioner as a potential liability to viewing them as an essential clinical partner.
So what does this all mean? When you step back and view the entire landscape we've mapped out today, the takeaway for anyone dealing with infertility is incredibly clear.
It is.
The practitioner you choose to support your journey matters immensely. The difference between someone who completed a weekend training course and someone who has dedicated nearly 3 decades to mastering the intersection of Eastern and Western reproductive medicine, it's not just an academic distinction.
Not at all.
It is the critical factor that dictates whether your care is generic guesswork or highly precise, biologically targeted support. It's about doing everything scientifically possible to improve egg energy, repair sperm DNA, and optimize uterine blood flow to give you the strongest chance of bringing home a healthy baby.
That's the ultimate goal.
Exactly. And for those who want to explore this level of specialized care, the clinic is located in New York City. You can learn more about their specific protocols by visiting www.berkeleycenter.com, or you can reach out to them directly by calling 212-685-0985.
This raises a really important question, and it's a final thought I'd like to leave you with.
Let's hear it.
We've spent this entire deep dive mapping the complexities of fertility, but the success of this dual mastery model points to a much larger shift. What if the ultimate medical breakthroughs of the next century don't come from discovering a brand new synthetic molecule in a lab? What if, instead, the greatest leaps forward in human health come from practitioners who dedicate their lives to becoming perfectly bilingual individuals who are completely fluent in both the ancient systemic wisdom of Eastern medicine and the cutting-edge microscopic diagnostics of the West?